If we could start with a motion to approve the January 10th meeting minutes.
Motion, Lydia.
Okay.
Thank you. Second.
All right, great. Thank you. All in favor? Aye. On the agenda tonight, you see we do have 16 resolutions. We have a number of appointments. There's 2 appointments to the Alcohol and Substance Abuse Committee. You'll see Brian Shank and the police chief, James Slayton, are on from the nominations to go on alcohol and substance abuse. There are Community Services Board member nominations: Tom Odessa, Brian Bush, Jean Canizzo, Dr. Adam Duckett, and Tristan Sims. All of these have come forward from the nominating committee of the Community Services Board to this meeting tonight, and hopefully we'll move through for legislative approval. And there's also one nomination for the Office for the Aging Advisory Board, that Mrs. Denton, and from Venice Road in Moravia, and that would be a multiple year appointment. I don't know if we'll be getting the appointment forms prior to the ledge meeting. I thought they would be in the works if anyone wanted some further information about these appointments. Amanda said that she had talked to Teresa Hominy and they would be working on some of the forms, so if we could get a little bit of background, we could. But obviously they're not here or they haven't been updated. But if I could get a motion to make those appointments.
So moved.
In a second?
Second.
Okay, all in favor? Aye. Great. As I said, we have 16 resolutions tonight. We can start with, well, there's 1 from Office for the Aging, 4 from the Health Department, 8 resolutions from the Department of Social Services, and 2 resolutions from County Mental Health. So if we would start with Brenda, if you want to come up and talk about your HHS 1. And if you have anything further to report, you can certainly do that after.
You're fine.
So this resolution is really just a routine resolution that we have every year. We have 2 fiscal years. Of course, we have the federal fiscal year, the state fiscal year. So these are our state contracts for our routine services, mostly under our ICE program.
Can I get a motion for HH1?
I'll move it.
Okay, second? All right. Any questions? The only question I had, Brenda, is I was just curious if, because we have talked about in the past the struggles with the ISEP program and the ability to get aid service, especially care services for the people that qualify. Are these an attempt to look at increased rates to see if we can make some headway in that area?
Yeah, particularly. So yeah, that's true. And I had mentioned that in my last report that we were looking to do enhanced rates, particularly for the PCA2 service, which is the hands-on service. There are a few companies out there that provide companion care and housekeeping. So that's a little bit more readily available. There's only 1 company right now that's even willing to work with us at all for the hands-on personal care assistance. This is for our older individuals who just need somebody to help them with a bath, with bathing, with grooming, with dressing, transferring, toileting, things like that on a intermittent basis. And it's one of the key ways we help keep people out of long-term care services, out of the nursing home. It's absolutely the hardest aid service to get right now. And it's a nationwide problem, but it's acute here in the county. So we've raised the rates quite a bit, and we've raised them within the city, and then to provide even more incentive to get people outside in the rural areas, we've actually even raised the rate higher.
So the increased rate to the agencies allows them to pay the additional rate to the
That's
aides.
part of the stipulation, is that we've raised this so you pay your aides more.
Yep. Yeah. Okay. And, you know, as we've talked about, you're going to try every opportunity you can think of prior to actually coming back to the county to say we might need to consider putting some staff on ourselves to get this money utilized and the needs met.
Yeah, that's true. It's just such a crisis right now. And weekend, we have federal and state funding to pay for these aides, and we just can't find the aides. The money's sitting there. It's meant to serve these seniors out in our community, and we're trying every which way we can to try to make it aid service. So
Great. Okay, Heidi?
Brenda, I wondered, ultimately, what do you anticipate that final rate is for the caregiver?
great question. We would like to see all the aides across the board, definitely making more than the minimum wage for food service, and preferably a significant amount more. Yeah. And of course, we know that actually some of them are paying 17 and 18 an hour in food service. So I can see aid rates need to be higher than that. Their jobs are much harder. They have to go house to house. They're doing hands-on care in some really difficult situations. They deserve really much better pay.
And we just have one agency right now that we contract with.
Yep, I contacted 4 or 5 other agencies.
Staff Kings? that you're referring to?
Correct. They're the only ones on here for PCA2 care.
Yeah.
Yep. And I couldn't get anybody to contract with us at all. One of the issues is that our total budget for the ISIP services is just under 240,000, and compared to what these different providers get under the Medicaid system, where their aides can go in for 6 hours a day in one home and get paid under what vendors get paid under Medicaid. We can't compete with that. They're always going to assign their PCA2 staff to those Medicaid cases first.
Longer cases, less travel.
Ours is typically 2 to 6 hours a week, where Medicaid will pay 6 to 20 hours a day for some of the situations. Yep. So that's why many other counties are really going to, when we look at paying an aide $35 an hour, an aide we have no control over, an aide that our clients could be on a waiting list for months waiting for one of those aides, we begin to wonder, does it make more sense to actually have in-house staff doing the aide service? If we have to pay a company that much to pay an aide a decent wage, and we still have no control over it at all. And this is what many counties are finding, and they're actually going back to the kind of the good old days where there were aides on staff as county employees. And then we can manage them, we can coordinate it just for our people under our funding, and really optimize the services.
And we talked at the Office for the Aging Advisory that there, in this particular program, there is no requirement for a nurse to do the orientation and supervision. So you wouldn't have to build that into your aging services.
Right, it's a non-medical program.
Right. So that would be another layer that we don't want to get into, and we won't need to.
Right, we don't need the licenses or anything.
Okay, thanks.
Wayne, you got a hand behind you?
I'm sorry, Lydia. That's fine. Just yell, thanks. I can't see you.
We all know that nobody in our county is getting any younger. So I see that as long as we're not losing folks leaving the area, we're going to have greater need, the baby boomers.
Right.
The folks that you're talking about, do they require special certification?
Training, but not certification.
And do we provide, does your organization provide the training, or is it easy to get training, I guess is ultimately what I'm trying to say.
Other counties are finding it doable, and they're using various means to do that, whether it be through an agency like BOCES, or contracting with one of the 8 agencies that's willing to add county staff into their training process. There's various different ways to do it. If we only had 2 or 3 aides, it would be probably a one-on-one kind of training.
Oh, we don't have that problem.
No, but you definitely raised a really good point, and this is really the concern. Is we've got this issue right now. It's been an issue, growing issue for 10 years, and yet we're not even at the peak of the senior population. And what really breaks my heart is that we are getting this federal and state funding in. There's people in the community that need the service. And these are people who have, they've worked, they've paid taxes, they've taken care of children, they've been, school teachers, educators. They've contributed to our community, and when they need us, we're not able to serve them. We need to do something better.
I was remote for the meeting. I think you were there. I know maybe you even asked the question. Kelly King, you did talk about something with employment and training, trying to look at an aid stipend program, recruiting people, having them, because that is a huge need. So
Exactly.
yep.
I know Center State CEO out of Syracuse has partnered with BOCES, has done some innovative work, but I just got an email from one of our vendors today, and she was apologizing because she can't get people served. She says, I know you have a waiting list and we're trying our best. Just can't do it. The aides aren't there.
So does this mean that we might anticipate you coming forward with a proposal to provide the county to provide services?
Yep, and because what's happening is, again, we've got this money coming in and I'm not spending it on people. And then so I send it back to the state and feds. We could be using it to pay for our own aides and providing service. So I'm going to rule out every other avenue that we can possibly come up with, but that most likely is going to be the solution.
And it's about $250,000 in funding, said about 240.
We also have some other funding streams that provide caregiver respite and some different things that also could be tied into that. But yeah, that would be a portion of it.
You'd
And-
be able
and
to
to-
cover the cost of the salary and fringe of the hire,
Yeah.
which,
Yeah.
And I do want to say that the agencies that are providing the housekeeping companion care, they do have available role. And so we wouldn't be excluding them or no longer needing them. We would be focusing on this hands-on personal care unmet need is where we would really target if we had some aides.
unfortunately, you might be taking the pool of candidates working for these license agencies, and they come to work for the county, but at least some of the needs of this program would get met.
And just having 2 or 3 for the county would help tremendously. 2 or 3 staff tremendously.
Okay, all in favor of this resolution?
Aye.
Okay, all right, great. Thank you. Do you have anything else you want to?
I did want to just follow up. I've been reporting for months now, and for those that are new, I just kind of want to bring you up to speed. I know a couple of you have been down in the basement in our office space. If you haven't, please come see us, get a tour. I wanted to give you some history. It indicates on the report here that I did get an updated bid for the space at Boyle. Over the last 4 years, I've gotten 3 different bids in an attempt to do build outs at Boyle to accommodate our staff. This most recent one came in and it was $100,000 to do some renovation over there, which is a lot of money. But what I want to tell you is I want to give you a little bit of background. The Office for the Aging came about under the Older Americans Act. The Older Americans Act was in that same era of Medicare and Social Security. It was a time when our country decided that seniors needed services, they needed to be taken care of. Again, they've contributed all their lives, and when they're in need, they need some assistance, we need to take care of them. So our Office for the Aging came about. That was a federal legislation. Decision was made by New York State that there would be an Office for the Aging in every county in New York State. Coincidentally, so it came about in Cayuga County in about the mid-70s. So you know that this county office building was built, I believe, in the mid-60s, according to the
66.
cornerstone.
66.
So when we had the funding to hire a director and a couple part-time staff, and there was a new department for the county, apparently there was no place to put them. And on a temporary basis, I guess it was decided to put them in the basement, which is our civil defense area. So we're in a little 800 square foot space. We have doors that have brackets and bars. We have a metal thing that comes down over our window. I think we're supposed to be able to withstand a blast. On the original floor plans for the building, this was listed as a vault and record storage. It is not office space. We started out with the 1 full-time person and 2 part-time. Over the last few decades, we have gained more and more federal and state funding, more and more programs. We've gone from 3 staff to 14 in-house staff and 5 staff out in the community. And yet we're still in that basement space trying to make do. We have 7 staff in the basement right now, plus a volunteer that works with us. We have 3 offices, which means we're all doubled up. We've been doubled up through COVID. Our staff have been wearing masks every day, all day. When we have clients come in, the staff have to leave. One of the staff has to leave. The offices are 7 feet wide. There's not enough room to bring somebody and their family member in for some kind of session to talk about their insurance, to talk about their long-term care needs. There's no confidentiality. People are talking about their medications, their finances, their health needs. There's no confidentiality at all. Our staff are picking up their computers. They're moving across the hall to the CMO room. They're moving up here. We're moving all around the building. There isn't consistent internet access. So even if we move, we don't always have our computers. It is getting unreal. As we've grown, we've had to move staff over to the Boyle Center. We were fortunate that at one time in the 90s, there was a decision made to do some expansion over there. The health department, social services, and office for the aging had some staff over there in the long-term care office. It was a lovely arrangement. There is no longer health department staff over there. There's one nurse left. That's been okay for us because every time we get new staff, now we have to place them across the road. The reason I'm bringing this up, we've been managing, but to have half your staff across the road, when we all collaborate and work together, we have very personalized assistance that we give individuals. It's a very collaborative process. Our staff have different levels of expertise, and we often have multiple staff working with an individual. It's very difficult to do that when half the staff are across the road. We have people come in for assistance. They show up in the office here when the person they have an appointment with is across the street, because the community doesn't understand that we're in two different places. It doesn't make any sense. I know that there's plans for a new building. I know there's plans for construction. I'm excited to hear it, and I really hope it comes to fruition. I have a letter in my hand from 2002. It says, "Dear Chairman Lockwood, I have spoken on several occasions over the past 8 years to former Chairman Stanbrook about the need to get the office to the aging in one location." This was in 2002. It's 2022. This was Nelsa Sellover. She was a director 3 directors ago. We can't continue to wait for a new building. We have to do something to get all of our staff in one place. Something has to be done. Something has to be changed. I've been talking with Elaine, been talking with Lynn. I've gotten these proposals from Boyle. I'm trying to figure something out. At the next ledge meeting, I hope to bring some proposal to you so that we can finally come to some resolution of this. Because it's just unproductive. It's not a good situation for anyone. I'd be happy to move into the new county office building when it's available. I would like and request even right now that the seniors give the due respect that they deserve, to have access to the building easily to the office for the aging for services. These folks in their wheelchairs and the walkers should not have to tread all the way downstairs and all the way down a long hall to get to us. We need to take better care of our seniors. So thank you for listening.
Brenda, can you survive? How long can you survive like this? I mean, really, because we had our first meeting today about the new, whatever we're going to do.
So what I'm going to propose is a temporary solution to get us out of there on a temporary basis until we can move forward. The county has a solution that really will work for us long-term.
You're bringing that on the 22nd?
To the next
meeting.
Oh,
service.
next month.
We're gonna, yeah.
Right. Now, this $100,000, what was that going to do?
So that
Remodel
involved an actual renovation of the space to provide
just for us, just for you?
2 HIPAA compliant interview rooms.
Okay.
The space is not really set up to accommodate 8 people and provide confidentiality as it is at the moment. With some partitions and such, we could probably set something up on a temporary basis to get us through and provide a much better situation than we have in the basement right now on a temporary basis.
I think Brenda, as disappointed as she was hoping that the county would invest
I know.
$100,000 in ARPA funds to upgrade that space. They'd stay there long-term lease and then eventually move to whatever the space the county. And we've been talking back and forth, and at minimum, if that plan doesn't make perfect sense, because now we're in the middle of, doing this building renovation, at minimum, she's going to be looking at how much would the space at the additional space at the Boyle Center, without $100,000 worth of renovations, how much would that lease look like year to year? So they don't have to wait, even if we do a new building, it's 2 to 3 years away. They don't have to be stuck in that space for another 2 to 3 years with the investment of maybe some decent high cubicles. Make that investment, have them lease space for that period of time, and eventually get out of the county office building. So it's a compromise that you were like disappointed to hear, but she sent me an email today. She realizes the timing is difficult to invest $100,000 over there when I think we're as serious about a new building as we've ever been.
Yeah, well, it's going to happen.
But keeping them in, getting some temporary space over at the Boyle Center for the next few years. It is, that's what we're going to try to work out with Lynn to see, how much would the cubicles be, what would the rent be, and where can we get the funding, whether it's ARPA, whether it's contingency, whether it's something, but some kind of immediate move to get them out of the basement and all in the Boyle Center. Maybe not the $100,000 space initially, but suitable space so that they're all together.
So Brenda, would that be just a yearly contract? Is that how you want to work it?
Yeah. That's
Well,
right.
that makes total sense to me. I'm only one vote, but it makes total sense. You can't be down there any longer. I mean, it's been long enough, and we all know that.
Mhm.
Anybody that's been down there and been in that office we give you so much credit for staying there for all this time.
Yeah, I'm
Kinda
afraid to
return
visit
with it.
anytime I have a meeting with Brenda. She comes
Yeah,
up here.
no place to meet them. We'll do whatever we can.
Thank
I
you.
promise you.
Appreciate it. Please.
Okay. If you don't mind, maybe Kathleen, if you want to just, because you have 4 resolutions tonight. And I'll go to Lauren. If there's no objection, I'd like to group together HH 2, 3, 4, and 5 and have her go through them, and then we can get a motion in a second for those. You'll see the first 2 are contract renewals, one with Bernie Bus, the other with the provision of STD services with 2 of the federal qualified health centers. And the last HH 4 and 5 are the acceptance of additional grant money. So how difficult could they be?
That's right. So thanks. The Bernie Bus Transportation, that was really cleaning up a contract issue. I think there'd been a little back and forth that Rich can appreciate because he was working with us on this. And ironing out the contract, which it's mandatory transportation service. We have an RFA with Bernie Bus. For our STD services, and April Miles is here from East Hill, so she can appreciate the fact we contracted STD service for screening, testing, and treatment is a mandate of public health departments. And we have contracts with East Hill Family Medical and Finger Lakes Community Health Center in Port Byron, so to give people options for services. And the reimbursement, it's always billing insurance first. So we have seen over the years the county share significantly reduced because of that. The next, I'm really excited about this next option. So you've heard us talk for years about the lead poisoning prevention, and we've had a lead poisoning prevention task force. We know there's been a lot of interest and you can't argue about trying to prevent lead poisoning in children, right, or in pregnant women or any matter because of the long-term health effects and developmental delays that can happen. We've always had some money to help offset the cost of our staff member to provide the necessary follow-up. So it's been more reactive service. We've been asking the state for years, how do we become a Prevention Plus program? And we just keep asking and keep asking. And this year they awarded us money. I literally had to double check. I thought the amount we were getting was for 5 years. But no, it's annual. It's going to be fantastic. We are in a great position to really make some truly preventive differences. And we really hope to move the needle on lead poisoning prevention. So we're excited and want to accept the funding to be able to move forward there.
Question behind you, Kathleen.
Yeah. Kathleen, does that include the increase in staff, or is that just?
So we will be working with contract agencies, but the senior public health assistant that we filled last month will be primarily
running
involved
this?
in this program.
And now covered totally.
Now
And
totally
now,
covered.
In
Sally.
addition to the funding you already had, this is more.
Correct. Yeah, we were pleasantly impressed with the
Thanks,
amount of money. And then our 4th resolution this month is a request to enter into a 5-year contract with the state for the Healthy Neighborhoods program. That's a really cool program that helps meet another injury prevention need. It focuses on, you go door to door in particular neighborhoods and we've had this function before. It's asthma prevention, it's fire prevention, it's falling prevention, it's indoor air quality like carbon monoxide. And we go to homes, and it can be homeowners, it can be renters, who's ever in these areas. We start with certain neighborhoods first based on their age of housing primarily. And it's completely volunteer for people to take part in it. We have great cooperatives with a lot of our community partners, a lot of our fire departments have accompanied us. We've gone door to door, which is kind of great because understandably, people aren't just going to open their door to someone knocking on their door and saying, hey, we're here to give you a fire alarm. So we're looking to start this up again. It's been on pause for the last 2 years because of COVID. The state hasn't awarded it. And now we've been offered this opportunity again. So we'd like to accept that funding.
Is this new areas?
It's a couple new areas, yes. So the city of Auburn again, so that's a repetitive area, but this time we're looking at the Port Byron, Menson, Montezuma areas is what we wrote. Whereas previously we'd been in the Moravia Lock area.
Yeah, great. All right. Madam Chair. Can I just get a motion, a second for these, and then we'll open them all up for questions?
I'll move them for discussion.
Second.
HHS 2 through 5.
Great. Okay, sure. Go ahead, Whitney.
For the funding that we'll be receiving, is this 100% funding or is there a match involved?
There is no match involved.
Thank
Yep, yes.
I just have a quick question for my own knowledge. Having left the young dad arena for a lot of years, and I'm well down the road of an old dad arena, I'm still surprised that lead poisoning is still an issue, quite honestly. It used to be in paint years ago and other products, but I'm kind of surprised to see this.
You know, I think you are not the only person who feels that. I am, when I started working at the health department, I felt the same way. But what's the big deal? What do you mean there's still a lead program? Primarily because of lead paint. And that's why older housing is a big issue, the peeling, chipping paint in some of our older housing stock. It's astonishing how much of an issue lead poisoning is. We have at the moment, and so if you bring your child to a pediatrician, they're supposed to be tested for blood lead levels at age 1 and age 2, and then as needed based on risk factors. And the past couple of years, and it's all around New York State, but as we know, again, aging of houses has to do, and it also has a little bit to do with lead paint that might have gotten in the soil years ago when people work outside, or hobbies, but primarily it's paint related. We have right now today 66 children who are in the program in the year 2022. Of them, 38 are in the blood lead levels of 5 to 9.9. That's the expanded a couple of years ago that we are required to help address. For the 10 to 14.9 blood lead level, there are 17 children. 15 to 19.9, we have 4 children right now, and 20 and higher, we have 7 children. It's high, and it's very high. What I didn't understand is the effects of lead poisoning. That was really where I probably struggled the most until someone really broke it down for me and said, not only can it affect your organs and organ systems, but it really affects neurologically a lot of your development, and some of the developmental delays that impact children in their growing bodies are irreversible. What I'd love to share with you at some point that I think you'd be interested in, so I will do that. A few years ago, we did a comparison to what the cost of like special education is compared to a general education. And many of our significantly lead poisoned children will go through special education for their schooling through grade 12. And if nothing else, the cost savings for their education, right? But it's for the health of the child. It's not just for education, but it's fascinating. It's fascinating.
Is there any remedy out there to lower the effects of lead poisoning to bring those numbers?
Yes.
Then
We really have a great cooperative, and our lead task force has brought this together a little bit more. So for example, we work closely with codes enforcement in various areas. So when they do rental property inspections, for example, peeling and chipping paint is on the codes. And so that can, along with having child lead tested, if codes identifies peeling and chipping paint, we can go in and we have what's called an XRF machine, that it's a special training, but it zaps paint like on windowsills primarily, right? A lot of windows are expensive to replace. So you have a lot of paint on windowsills. And little kids and toddlers, they'll climb up, you open the window, you get the friction, so you get dust. If you're crawling around on the floor, your toddler might get their hands dirty and get paint that way, or if the crib is near the window, kids gnaw on everything. That's a lot of how we see poisoning occur in the youngest children. It's just,
What the state makes you, based on the lead level of the child, mobilize a team to go right into the home, do education, this lead testing, all of that.
there's nutrition that can help reduce the, get the lead through your body, like high iron foods can help kind of, I'll say, draw out and purge the lead a little faster. So nutrition plays a factor. But it's mostly the preventive aspect that you try to do. And so what this is going to allow us to do is really work with some of our partners on physical prevention, right? Maybe, so a lot of people, if there's a home that's identified as having lead paint, you need to have a lead certified contractor help address it. So that's my phone ringing, I'm sorry. That's why I gotta say that. I'm like, sorry, Christine's like, I'll hang up for you. So that's good. And it has to do when you do the repairs, not to get the dust throughout. Sometimes kids get poisoned unknowingly by families who are trying to fix up their house and they just didn't know that happened. Replacement of windows is it's a great thing to be able to help take care of things. There's certain types of, better paint, sealing the area. Sometimes you don't have to remove the paint. Sometimes it's better just to seal over it. Right. So lots of stuff we're learning about. It's really fascinating. It's a really great opportunity for us.
Thank you.
Any other questions about those 4 resolutions?
I did have a question. The Healthy Neighborhoods program, do we select those? Does the state require us to select target areas?
They do. They do. And they look for certain things. They look for age of housing, conditions of housing, economics, also factors where it could be more challenging, rental property, where it could be more challenging to maintain or provide, where there might be lower socioeconomics in particular, but certainly not exclusively. We know that it's not all economic based, a lot of the injury prevention needs.
Do you work with the fire departments with that program?
We do. And in the city that was really cool because you go out to you pick a block or a couple of blocks and you do door tags in advance and say, we'll be coming around on these dates. And we would have our Healthy Neighborhoods workers that be accompanied by the city fire department. And when we were in Moravia, when the volunteers were available, they were great about, but of course they're not as available a lot of times because they're volunteers. But they loved seeing the fire department would install the fire detectors right then and there. Talk about that, whereas we could interview the family member and say, you have toddlers in the house? Maybe we could get you something to help your child not turn on the stove. So we do just a guard for that. You can be very creative with this and it will really dovetail beautifully with lead poisoning prevention as well when we go in there.
I live in one of those neighborhoods and pre-COVID, I got the little door thing and it was summertime, so I was home and the team, firemen came in, but I think you must have hired summer interns or something. They were the coolest young people. And at the time, my elderly father was living with me and they were all about checking to make sure I had things in order for him. It's a great program. Yeah, great program.
Yeah, it's really neat. I know like Office for the Aging, a lot of times it's done some fall prevention work. That's another thing when I'm happy. So it's for the spectrum of age groups, which is.
They left me with all kinds of literature and, one of the fire things didn't work and I just called the fire department afterward because it started turning on constantly. They came right over and replaced it again. And I'll tell you, the neighborhoods who are getting served are very fortunate.
Okay.
Yeah.
I'm glad it was a good
Yeah, it
experience.
was a great experience.
And Dave, you
I
asked a
love those
question.
young-
I thought you were asking whether she was going to bring on additional county staff with it. And no, I think you have relationships
We're,
to do it
we're
without adding hiring.
contract out with a lot of
Great.
our partners.
They
And it's
both
good
sound
for
like
all
they're
of us because there are agencies that serve housing. And so we like to work with them and then help.
That's a
meet
lot of
their
money
needs.
too. 5 years and they get, every year you're getting that money.
And so the money is used for contracting, but it's used to purchase these items, right? And it's,
Yeah, they filled my entire house where needed with those alarms. They showed me how the ones I had in were, subpar and that they put in the top of the line, whatever is top of the line for the time period. Answered all of my questions, put in the carbon monoxide thing where it should have been. Things that I was guessing as a homeowner, they came through and said, this is more appropriate.
Yeah.
The things that surprised me, even about the placement of fire alarms.
I think that was
Was
the big one,
amazing.
where you should put it so that you can, if there's a light on
Yeah.
it, so you can see on your way out. But also, again, I was one of these people, I'm like, oh, I've got smoke alarms. Well, they were 15 years old. It's time to replace them.
Yeah.
Long time I should have replaced them.
Yeah.
So you learn. Yeah.
Any other questions? All right, all in favor of 2, 3, 4, and 5?
Aye.
Any opposed? Great, thanks.
And if I could just mention a couple more things here on the notes that you've seen. We're continuing to work right now. Actually, we're just finishing up in Southern Cayuga where we've been holding at Southern Cayuga School COVID vaccination. And we're participating in the state initiative for vaccine for kids. So that's great. But going down to Southern Cayuga not only, of course, gets us out into the community more, but it's specifically chosen to try and help serve farm workers more so, which is wonderful. So we have some translators in there and we're staying a little later to be able to catch people between shifts for farming. And then I know I had said last month that I was going to try to just talk a little bit about, so you heard me talk about healthy neighborhoods and lead a little bit today, but I wrote down just a little bit that goes to some of the funding and some of the core requirements that public health has to perform, exclusive of preschool and early intervention that's housed with us, exclusive of environmental health and WIC. But there's 6 core areas: chronic disease prevention, communicable disease control, emergency preparedness, family health, community health assessment, and then some general public health work. We have to have programs in all of these areas to meet these needs. And we get our base grant of $650,000 because we are a full service county. When we expend $650,000 in these core areas, then we get 36% reimbursement to the dollar in these areas after that. And each year it's a little bit different depending on type of grant programs we have to offset the core grant. So sometimes we hit that grant in July, sometimes it's September, and or thereabouts, just to give you a general sense.
I just want to thank your staff and you for yesterday helping me with that press release and the internal release. Deanna did a lot and so did you. I appreciate it.
Thanks.
Thank you.
Sorry, Christine.
Me next?
No, sorry. Sorry.
Little tease.
There's only 2 resolutions for Lauren, not a lot more than me. So, everybody, this is Lauren Walsh. She is the new Director of Community Services. She's the individual attached to the resolution that we passed in January, bringing her on.
Yeah.
She'll be overseeing the county mental health operation and functioning as the Director of Community Services in terms of mental hygiene law, the plan, Community Services Board, all of that.
All of that. Yeah.
All of that.
Well, it's nice to meet all of you.
Welcome aboard.
Congratulations.
Thank you. So the first resolution is about entering into contracts with youth centers for functional family therapy and safe care. Functional family therapy is, they're both community-based services. They go into the home to provide these services for families. Functional family therapy addresses, really it's a therapist that comes to the home and does family therapy with the family, addresses all sorts of different mental health issues or behavioral issues with the youth and the family. That is goes up to 18 years old. Safe care is for younger children and parents and families, where the worker comes into the home and works on safety, parenting skills, and they go through a whole bunch of modules as far as
And then they do assessments at the end of those to ensure that the parents are learning the skills and can effectively use them. These are reimbursed 100% mental health state aid and Medicaid reimbursable when they are able to bill for those services.
So you've dedicated part of your $1.4 million in mental health state aid, and you've dedicated some of those funds to support these programs for
Yes.
children and families in this community.
Yes.
Great. Okay, can I get a motion for, it's got to be numbered, I guess. It's been revised, so it's HH 15. Motion,
Nightingale.
second?
A second.
Okay. Any questions about? Okay, all in favor?
Aye.
All right, if you want to go over to HH 16, and if you recall, this was the resolution that we tabled in January because there was discussion around putting Medicaid assisted treatment in the jail, and we tabled it, and you've already met with the sheriff and started to talk about accepting these funds and how a program might look.
Yeah, so this is to just accept the money to be able to use it for the mandate that's coming. Well, the mandate is already in place. It has to be done and effectively in the jails by October of this year. So I've already met with the sheriff to discuss sort of how we're going to plan that together and work collaboratively with that, and how we're going to bring that medication into the jail and do it in a safe way, and also getting the inmates the treatment that they need there. So that's what this resolution is for, is accepting that money.
You know, motion?
I'll love that.
Okay, second, great. Yeah, this is additional OASIS money that the state's making available since they're making this mandate.
Yes,
Do
yes.
you have a sense this will cover?
Yeah, I hope so, but there's also, I mean, in the state budget, there's a lot of money coming from OASIS, so they may have other funding coming down the line here to make sure this can continue. So
And this could make Suboxone, Vivitrol,
methadone,
all accessible.
all has to be accessible in the jail.
So there'll be a prescriber that will see these individuals and start treatment. And then
Yes.
at the time of release, they would already be on some
And then
type
they
of-
would be, some discharge planning as far as them getting a, provider in the community to be able to continue those medications once they're released.
Great. Dave?
Yeah, Lauren, who's the provider? Will that be a doctor or one of the nurses out there?
So we haven't exactly came up with a plan, but mental health does have a prescriber out there currently. And I know they have some nursing staff too that
Right.
can administer the medication. So it's in the works as far as like specific planning, how that's gonna look.
Thank you.
Okay, all in favor?
Aye.
Okay, great. Do you want to?
Yeah, that was one of my updates, is that,
Mhm.
working with the sheriff and, trying to be as collaborative as possible to make this work, because there's a lot of questions around it. So hopefully we can do it in a really safe way. The other thing that I just wanted to mention was we've had some preliminary discussions about the opioid funds that are the settlements. So kind of looking at the end of the Healings Community Study approaching, and all the work that they've done, looking to kind of continue some of that work, but also broaden that to all substances, not just opioids like that was focused on. It was really focused on decreasing overdose deaths. That was a big part of that focus, but we really want to move to continue a lot of the Narcan distribution and MOUD treatment in this community. So hopefully that is something that we can eventually bring a proposal for.
Yep, and again, we had a preliminary meeting, Monica, myself, Lynn, and I got the impression there was more support. And we met with Dave too. There was certainly going to be more support for potentially using the opioid settlement money for the continuation of this coordinated effort. And we're also waiting to get from Monica some of the impact dollars that they've passed through certain organizations, when those dollars might be expiring. And then we could get a sense of what community-based organizations might be needing around their work to also tap into some of those funds as well. So, I think there was some concern that, the community-based organizations that relied on some funding might not be in the mix, but we're trying to look at all of that. So I think the Healing Community Study did get some good news, because I think they are very well respected by Columbia. they're going to allow them to continue paying for the staff longer than thought. And I don't think they thought that was going to happen, but the impact dollars will be expiring soon. But we're trying to work out a whole proposal that might make sense, that would be looking at the opioid money, sort of putting the ARPA ask to bed.
Okay, so when you say we, you mean the the Community Services Board?
The Community Services Board, see, that was the one thing, Lauren, that came up. If there was money that was going to be leveraged, and if there was funding that would be going to community-based organizations, even using this opioid money, they can't just be calling and knocking on Dave's door and say, Dave, could you give me so, the vehicle might be the request coming through the Community Services Board, the subcommittee on substance use disorder, and having the proposals sort of vetted that way. But, we're just in the very early stages of this. It doesn't seem that there is a huge rush that we initially thought to bring something right away, but, continuing the coordinated effort, working through the mental health department, looking at the opioid money is really the direction that I think, we're going to be going. And I think, Dave, you were the one that said it made certainly more sense to you.
Yeah, but use the opioid instead of, ARPA money, it just makes sense. And Rich will tell you, we're still getting money in from the opioid, right? But
There's
we
more
don't,
settlements to come.
so we're gonna be even
there's-
getting more.
Hundreds, if not thousands of defendants out there who are in some measure of litigation with this stuff.
And I think you told us, Rich, too, that we'll have some of these settlements are being front loaded the first 5 years.
Yes.
Instead of at 1.4 million for 18 years,
Right.
we're anticipating getting some additional funds for those first 5
Yeah,
years.
I think our rough estimate is that there may be like $300,000 available 2022. And then there will be continuing monies available for next 10 to 14.
And a portion of that must be reinvested in
Yes.
services. The other could not be, but if the county opts to reinvest it all in services, then, and we still have a huge need here, so, still there'd be appetite to do that. Okay.
Thank you.
The only other thing was mobile crisis. I know that
Okay,
there was some
yes.
confusion
Oh, yes.
around mobile crisis, so I wanted to kind of clear that up. I know there was an ARPA proposal put in for kind of a joint mobile crisis teams with mental health and DSS. I met with Christine, we talked about that. It just seems like that might not be really possible considering, staffing over there.
Daytime coverage
Yeah.
for,
So we sort of put a new proposal together that I think makes a lot more sense, is to look to hire a therapist and a case manager as a team to provide mobile crisis during the day that mental health will provide. That way, we're able to bill for those crisis services. It's us and Liberty Resources who does the after hours right now, but we are approved to be able to bill Medicaid for those services. So that's what we're looking to do, is kind of build our own team from 9 to 5 to be able to go out on calls, take crisis calls, and be able to bill for those so that it will sustain itself in the end by having, Medicaid reimbursement there.
And when I spoke with the sheriff, because I know that I thought the original ask always was midnight to 6 a.m. And then we got into the big discussion. What's the volume of business between midnight and 6 a.m.? Should we pay $235,000 if we don't know the volume of calls? But he had confirmed, and so did you, Lauren, that, if we expanded in this proposal during the day, it will still free up law enforcement. Because right now they pick people up, drive them to the mental health center and sit there while you're attempting to mobilize staff to evaluate.
Right,
them.
or bring people to the hospital and then sit there. They have to sit there
Right.
with them at the hospital until they're admitted, or they,
Kind of like we
hospital security can sit with them. It takes up a lot of their time. So hopefully this will eliminate that, and we can have hopefully we can divert people from the ER anyways. That's the whole goal of the whole program, is to keep people out of the hospital if they don't need to go, so.
So even daytime coverage will be expansion of mobile crisis.
Yeah, and I mean, we are looking, I know the city has talked about overnights. I've had some discussions planned with them, so I think we need more information as far as what is the volume of calls that are coming in during those hours. Does it make sense to do that? I think the daytime makes a lot of sense to start with, so.
And you put an ARPA request
Yes.
in for the the coverage of the therapist
And the case manager.
okay, and that eventually it will be offset with crisis billing. Okay. All right,
Any questions?
Thank you very much, Ron. Very good, thank you.
thank you. Welcome, you'll hate us soon enough.
Just starting,
Yeah. I mean, no,
the honeymoon, right?
all right, Christine, yes,
Last but not least, I have
that's
a
right,
bunch.
stop bringing so many resolutions.
I promise, January, February are heavy hitters for us. So,
6, 7, 8, 9, and 10, right out of the gate are contract renewals. So why don't you go through all of those,
okay, 6, 7, 8, 9, and 10.
just for now, and you can go.
Okay, gotcha. So page 6 is contract we want to enter into with Cayuga Centers. This is a renewal of services that we have contracted for with them for a number of family-based interventions, family preservation, family support program, enhanced foster parent support, and MST. So if I could just take a second to talk a little bit about those, I think that it helps kind of to understand the services that we put in with families. Family preservation is one of our most intensive interventions that we have with families who are at imminent risk of placed in foster care. There's this contract would have 2.5 workers, 2.5 full-time workers from Cayuga Centers that would work in the home with these families that are identified by the department as having kids that are very close to coming into foster care. We've had this program for as long as I've been here, in services. We've had family preservation, and I think that it's one of our most successful interventions that we have to try to forestall kids coming into foster care. These are clinicians that work with the families. They do a lot of, it's the families are in crisis during the time that the kids are that higher risk of coming into care, and they just, can kind of figure out what's going on, put services in and supports, make referrals, do work on parenting skills. I mean, it's really very comprehensive, very short term though, it's 4 to 6 weeks. The step down from that is the family support program, which is a less intensive, longer term intervention that works with some of those same families once they transition out of FPP, or maybe families that don't need quite that high level of intervention through FPP. And same kind of thing, very comprehensive. They meet the family where they're at, pretty much give them whatever support and service they need. Trauma focused, master's level clinicians. And then enhanced foster care support is a newer program for us, but a renewal of the contract. This is a program that we developed ourselves really to help support the foster care parents, the foster parents that we have taking care of our children in foster care. They are, they pretty much, again, they do whatever it takes to try to keep the child at the foster home level placement with our foster boarding homes. They're clinicians. They have, it's for 2 workers, I'm sorry, yes, 2 workers, and their caseload is about 10 or 12 families per worker. The goal of this program really is to prevent the foster home from telling us that they can no longer maintain that child at that level of home. So to prevent disruptions, to prevent movements from one home to another or a higher level of foster care. MST, that is an evidence-based program, multi-systemic family therapy program, home-based model. The clinicians work with up to 6 families at a time. It's a 3 to 5 month intervention. The goal is to increase parenting skills, increase positive family relationships, help kids do better in school and be more successful in school, reduce truancy, and reduce negative peer associations. Target population for that program is a little bit older. It's 11 to 17 years old. So these are some of our most successful programs. I know this is an expensive contract. It is for $685,660, but it's for 7.5 workers for the crossover from foster care, child protective services, our own foster homes, and we think that it's very well worth it. The thing that I also want to say about this is that the amount of the contract is for up to $685,660. Cayuga Centers has the ability to bill for Medicaid for portions of these services that are eligible for Medicaid funding.
So it's hard for me to say exactly how much will be reimbursed by Medicaid, but there will be portions of each of these programs that they can bill Medicaid for.
Just for clarification, if it's still the right information. These are preventive programs that are reimbursed by the state and federal 62% of those costs. And the state had said before, they capped the foster care block grant. So they only give you a certain amount of foster care money. If you exceed that, that's anything in excess of that is 100% local.
Yes.
So they're making the point, the more you invest in preventive care, we'll reimburse you up open-ended 62%. If you don't feel like doing that, once you exceed your block grant, then just pay. Yes.
Yes. Okay, so that's H86. Just want to keep going through them. Just keep going. Okay.
Yep.
H87 is another contract with Cayuga Centers for the provision of 4 respite beds. So this is Cayuga Centers has a house home on Franklin Street Road that has provides respite beds for children. We would like to contract for 4 respite beds at Cayuga Centers at this house. It's $200 per day per bed. It is a $292,000 contract. We use this for a variety of things. It's for preventive respite for children that we're working with that are disrupting in their house. They need a little bit of a break from their family. It can be planned. Sometimes it's even in a crisis situation that we know something's going on. We maybe need to get another program involved with them. I know it's going to take a little bit of time to get them in there. They need a little cooling off period. So we put the child in the respite home for up to 21 days to kind of settle things down and to just slow it down so that we can be thoughtful about what needs to happen next. We also use the respite beds as an alternative to detention for youth who are involved with family court or behavioral type, concerns, JD type concerns. And the children that can stay there are 10 years old to 17 years old.
Christine, do we pay for those 4 beds no matter if we use them or not, right?
Yes.
They're safe for us for the whole year?
Yep.
Okay.
Yep, we have access to the 4 beds.
Great.
Sometimes other counties will use the bed, and in that case, then we
They
don't have to
reimburse
pay for
us.
that. Yep, that day.
Great.
Yep.
Thank you very much.
We use them like heavily though. H8 is to enter into a contract again with Cayuga Centers for the provision of supervision and monitoring services. So this is this contract is $305,000. It is for 3 full-time equivalent case managers who have caseloads of up to 20 youth per worker. They provide, it's called risk case management, RCM is the kind of acronym that we use, and also court-ordered supervision. So this is a contract for both of those components, the case management and the supervision. Not every family who's involved with these programs have both. The supervision is what's court-ordered by family court for certain situations with youth who need intensive monitoring because of trouble they're having in the community, things that are doing that are not safe, within their family or out in the community. Referrals for the risk case management component come through the FAST, through the Families Access to Services team. That is our community kind of front door access for children that have significant, behavior concerns and need access to services. So between the FAST team and family court, that is how folks get referred into this program. Okay. HH9 is for a 2-year contract with Chapel House, which is our temporary homeless shelter for men on Franklin Street. This is a 2-year contract. Our last contract was also for 2 years. We're asking to extend that by 2 years. This is at a rate of $57 per diem per person that is staying there.
Is it for just housing or
This
case
housing.
management?
So not include the case
Okay, but
management.
it's still, the hotel stay is 90?
95 for some of
Okay,
them.
so that's why this $57 is
The
more
party.
appropriate
Yep.
option for people looking for emergency housing.
And Chapel House is a 15-bed shelter. It's for single, like I said, single men. They also house some veterans there. The number of folks that we have there varies depending on need and depending on how many veterans they have housed there. We had last Friday on the census, I saw that we had 11 men there, and I just talked to the director of temporary assistance today, and he said 9, 10, 11. That's usually what our number is looking like, especially not this time of year when there's cold blue, when there's the emergency order to house, when the weather is under freezing. I did want to mention that this is an increase in rate from last year. When I talked to Chapel House director, that really their ask on that was due to increasing costs of utilities. They've had a really hard time maintaining steady staff. Staff that want to stay. That's been a huge struggle. And so his thought is that if they can compensate their staff a little bit better, that they will be able to pull in some quality folks that are going to be committed and stick it out. And training people, this kind of cycle of people getting trained and then leaving and trying to go back to the drawing board and getting new staff in has been very taxing on them. And they've ended up having to pay, quite a bit of like overtime. So it's been a challenge.
Yeah, Christine, the Grand Ave Motel, that's still,
I was going to talk about that too.
yeah, oh, were you? Okay,
Yeah,
I'll wait till
I
then.
figured that we would want to talk about.
I'll wait till you get
Okay.
there. Thank you.
Okay. And then HH10 is on the list. Yeah. Okay, this is a contract that we have with the Children's Home of Wyoming Conference, voluntary agency that provides recruitment and training and retention services for our foster parents. So we have 2 workers right now that work in-house right here at ESS that are embedded right in our foster care area. They are the folks that work on trying to find folks in the community that are interested in being foster parents, so recruitment. They also do the training classes for folks that come to the table and want to be trained as foster parents, and then do all of the work with trying to retain those people and helping them want to stay with us and, continue to take in children for us and all the paperwork that goes along with that. We've had very good success with this contract with Children's Home of Wyoming Conference. It was an RFP that we did 2 years ago, and they were new to us for providing this, and I've been very happy with them. And to the point that we put in our budget for 2022 to add to this contract a foster care support specialist into this contract with them. So this person would be one full-time person who would provide some very concrete supports to foster parents. When we've talked to our foster parents about what do you need to feel better about sticking with us, what do you need to feel better about taking in children that we're asking you to take care of, they have said that some real concrete things, like when you call us and we need to take in a child, I might not have childcare for a week. I might not be able to find a daycare provider for a week, and I might need somebody to come over for a few hours during the day to help watch this child. This person could do that. They might need to, run children to the doctor's appointments if they need when children first come into care. This person can do that. It's pretty much, it would be tailor-made to whatever's happening. One of the big pieces too that foster parents want is some sort of support for each other. So part of what would be built into this is this person would, from the ground level, be involved in building a foster care support group, and help run that, help facilitate that, take care of the kids during that. So I think this is going to further our ability to help support the foster parents and keep them at our level of not lose them to therapeutic, or not lose them because they're just feeling so overwhelmed with taking care of the foster children.
Christine, how many foster parents do we have right now? How many families?
We have, I think we have right around 45.
Really, that many?
Mhm.
Wow.
Right around 45.
And how many foster kids are we? Are they
Right now in foster care, children in foster care, right now we have about 100.
really?
Yeah.
That's a lot of parents. That's good.
Yeah.
Isn't that high?
But yeah, we've been able to, through this contract, we've actually had success
Great.
at increasing our number of foster parents. Yes,
Because they used to be awful hard to find.
they still are.
So this will help.
Yep, they still are.
Great, thank you.
Let's get a motion, a second for 6 to 10, and then we'll just open up to questions if there isn't it. Make a motion for
HH 6, 7, 8, 9, 10.
second.
I'll second.
Okay, do you have questions about one of those?
I just wondered if you find in recruitment, is there a particular demographic that describes your foster care parent? Does it tend to be working or stay-at-home parents? When you mentioned, you know, that supportive care that was concrete, like coming in for doctor's appointments, et cetera, is that because they're juggling work and foster care,
They are.
just like every
Yeah.
family?
When I first started, it was foster parents, usually one of the foster parents stayed home. And they weren't, working, both working. That has been very much shifted. Most of our foster parents work outside of the home, and some of them are single parents, and so they don't have someone else at home to help them, with caring for the children. So yeah, I think things have shifted around. They're professionals, they have professional jobs, don't have flexible hours.
Brian, do you have a question?
Yes, I do. Do you have any idea what the average of care, like the average a foster parent has, like per children? Like, is it 1.1? Is it 2.2? And is there an ideal amount of children they should have at one particular time?
So I can't tell you the average number across all of our foster homes, but I can tell you that when a foster parent is certified to take care of children, the number that they're qualified and certified to take varies depending on their home, like how many bedrooms they have. And really it's a discussion with the department around the needs of their other children, the ages of their other children. And so a lot of that is kind of coming to the same conclusion around, this is what I can manage. Even if I have a ton of bedrooms, maybe the best for me right now is to only be able to take, 2 children in. So I can try to find out, what the average is, but I don't have that right now.
Thank you.
You're welcome.
Are these contracts all renewals, and are they all budgeted for already in your budget?
So HH6, those are all contract renewals. We already have contracts for all of those services with Cayuga centers. HH7, that's a renewal. HH8, which is for the supervision and monitoring, that's also a renewal. 9 is a renewal. And 10 is a renewal, with the exception of that one worker that we did budget for this year. So
Okay.
that's in our budget, and all of these are within our budget.
Okay, thank you.
Thank you. How do the children get into these programs, or the families? For example, the family preservation program, the family support program, are these all court mandated? Can people reach out and say, hey, we have an issue in our home and we need your help? How does that work?
So a variety of different ways. So some of these programs are where a family could call the department and say, like, I'm struggling. They could call mental health, and the mental health folks, at the clinic could refer them to us to say that there's somebody that's struggling. Family preservation primarily gets referred to by the child protective services workers, because those children are so close to coming into foster care. Those are the workers from the department that are working with those families at that point.
They start with a CPS report.
They usually start with a child protective report. I mean, that's not to say that there couldn't be some sort of other situation out there that CPS isn't working with right then that we would recommend FPP for. That sometimes happens, but by and large, it's child protective involved families. Family support, I would say that also is, those are department involved families that are working mostly with preventive services. So when a family is in such crisis that they need family preservation, usually there's a component of preventive services that gets put into place, by the department. So there's a case manager from preventive services that's working with the family too, and then the family support program would be considered after FPP drops out or drops down. Does that make sense?
Yes.
And then enhanced foster care. I mean, those are, that's kind of an in-house program for our own foster care. So that's in-house. MST, the families that get MST are referred by FAST. So FAST handles the MST referrals. They know that the families that are in the most crisis, that are having trouble with those, that age youth, and FAST manages, putting those referrals into place.
That's a group of people that get.
It's a group of people. The department's represented, mental health is represented, school, probation. There's a bunch of folks at the table.
So what is FAST an acronym for? If you don't-
Families, access to services thing.
So, thank you very much.
Okay. Can we vote on 6, 7, 8, 9, 10? All in favor? Aye. Okay, great. You could throw 14 in there if you want, Christine, because that is another contract renewal. And that's using 100% monies that.
Yes. So Pathways for Hope is a contract that we have with Salvation Army. And this is really a program to help support families that are receive temporary assistance for needy families, TANF, helping them to look at the barriers that are really getting in the way of them achieving self-sufficiency. So a lot of the families that they work with have kind of intergenerational poverty issues, and they really, these families need a lot of case management and attention paid to, like what's getting in the way of you being able to get a job, keep a job. What are those things in your family that are really difficult for you? And for some of these families, it's their children have medical issues or they have medical issues, and making sure that they're hooked up to the right doctors and the right services to help them manage those illnesses or whatever's going on. It could be there could be domestic violence happening, and there needs to be some decisions made around that, and that's preventing them from being able to get out and get a job because there's the issues with the battery around control and not wanting somebody to leave the home. So it's really trying to engage with the family and try to take a look at what are the barriers and what can we do to overcome them. And it's not a quick fix. It's not a short-term program, because a lot of these are situations that really need to be taken care of over time, and there needs to be some sort of trust developed with the worker. This worker is one full-time worker. They work with 10 families. And we've had the contract for a few years. It's a renewal and it is in the budget.
Motion for HH 14? Second? Okay, all in favor? Great. Okay, we're getting down to the wire. HH 11 is to accept 100% federal funds from flexible fund. Yeah, second. I mean, what can you say? No, we don't want to.
I love these.
Second. Can I get a second for that?
Second.
All right. All in favor of accepting this FFFS money?
Aye.
Okay. 12 is to fill a human services examiner position in the department. It's a budgeted vacancy.
Budgeted vacancy due to retirement. We need to fill this.
Can I get a motion for that? Second? Second. Okay. All in favor?
Aye.
Okay, and last but not least is to renew a maintenance agreement with Humatic. Yes,
So Humanic is the system we have on the 3rd floor in the county office building in our temporary assistance area. It's the queue. We used to have long lines of people waiting at our windows, the reception area. People would wait there, they would get up to the window, and maybe they only needed to pick up a piece of paper and didn't really need to wait in that line for that long. So Humatic is a system where people can kind of check in at this little kiosk. They can say what they're there for. We know they're sitting in the waiting room because there's a screen that tells us who's there and what they're there for. That makes the flow happen a lot smoother. I just checked today, we're back up and using that full board again during COVID. When things were different around the traffic flow, we didn't use it as much, but it's definitely, folks are moving in. It helps to keep the flow happening, helps just be more efficient. So this is a maintenance agreement so that if anything breaks, they're able to come in and fix it, and we don't have to start from scratch.
Budget?
It is budgeted.
So move.
Second?
Second.
Say, all in favor?
Aye.
Great. Thank you.
Do
You want to?
Yeah.
You want to talk
So
about
we just talk a
Grand
little bit about
Yeah,
Grand Ave.
please.
Okay, So I did want to mention, I had stopped up to see Karen Gould last week when the Grant Motel on Grand Ave in Auburn was condemned by the city. We were involved in numerous calls with the city around, what was happening, and went out with them and saw the conditions of the home. We had at that point had 12 individuals housed at the Grant Motel, and were able to move them to various other housing options within the city and outside of the city. I've been here a long time, and I had never seen anything like this happen. I think I'm really proud of our staff for like mobilizing quickly and making it work to get everybody housed very quickly.
You went on scene too.
I was there.
You went yourself with the code.
There was a lot of people there.
Yeah.
I was there with codes. The fire department was there. There was a lot of people there, and I've been having some conversations with the hotel about getting the folks that we had housed there had belongings there that they weren't able to take that day. So I've been talking to them about getting the folks' belongings where they need to go, and having some conversations with her. It sounds like she's making some moves to get some repairs done, but I have no idea how quickly that's going to happen. But I just wanted everybody to know that we do have our folks housed. We had a number of individuals that were parolees or sex offender parolees, and parole's aware, they're okay with where we have them placed now, and I think everybody's doing okay. But it really did kind of shine a light on the concerns that we have, with housing, emergency housing, and some of our really challenging folks to house. So, trying to do our best to try to manage that. Our census last Friday, as far as our homeless numbers, I know that you were in Chairman Gould's office when I, was up last week, and we talked a little bit about the numbers, and just want to make sure that everybody's aware, like the extent to which we are, housing folks. We had 122 homeless folks, and that includes 17 families, 105 singles. So that's what it looked like last Friday. And every day it varies, it goes up and up, down. But for the last probably 6 weeks, that's right about where we've been, about 120 or so.
Not all are in hotels.
Not all of them are in hotels.
Okay, but some are.
But on this census, 88 of them were.
Wow.
Yeah.
And we're paying 95 a day, you said, Christie?
Most of the hotels that we work with are
90?
Yeah, some of them give us a deal, 350 a week. There's a daily rate of 95 if it doesn't go for a week. So right around there. Yeah.
How did you make out with the court order to get the person out that refused to leave? Was there any problem with that?
Voluntarily left.
He did. Great.
He's
So we
getting
didn't-
some
We
support.
didn't need the court order.
Nope.
Great. Thank you.
Yep.
Great job. Your whole staff did. And to have you go out yourself, that was very nice of you. I'm sure they appreciated it.
Thank you.
Thank you.
Does anybody else have any questions about that?
Thank you very much, Christine.
Thank you, Christie. Great job.
Get a motion to adjourn unless anyone else has anything they want to add.
So move.
Second. All right.
Seconded that.
That was an easy one, right, Bobby?
Thank you. This is my earliest night this week.
Oh,
Thanks, everybody.
is that okay?
Thanks for moving the time. We appreciate it, Lane. Thanks.
Is Lee your last one tonight?
Thanks, everybody.
See y'all later.
We didn't
Thanks,
think
Rich.
to invite Lloyd. We didn't think to invite Lloyd. We just got to kind of regroup.
Right.
All right, bye-bye.
Figure out our priorities.
Okay.